introduction that I've ever had, so that's great. I'm really excited to be here today, and I want to thank you all for inviting me, because this is an organization I really respect and admire. I think you guys have an incredible history, and so it's really exciting for me to be here today. My name is Casey, and as Sandra said, I work for TerraGraphics International Foundation, or if you're lazy, we say TIFO, so it's easier. And I thought I'd kind of give you an idea of what we do, mostly by walking you through some of the projects that we've done. And so, just as a quick background, we are the nonprofit successor to TerraGraphics Engineering, who many of you have probably heard of. They were here in Moscow for over 30 years. Our mission is to reduce health impacts associated with mining and recycling around the world. We principally work in low and middle income countries. And a big component of our projects is to focus on capacity building. So I'm going to talk to you about a lot of health risk assessment projects. I'm going to talk to you about remediation and cleanup projects. But it's important to note when I'm talking about these projects, TIFO is not going in and doing cleanup. We work with local governments and NGOs and universities and advise and train and build capacity for implementing those projects. So we are not the implementing agency. We are really building capacity for those things to go on in those communities. TIFO itself is tiny. Jeannie Harvey's here. She's on our board of directors. We have a few core staff, but we rely on an extensive network of experts. So we need to have people who have expertise in toxicology, chemistry, geology, environmental science. The list goes on, public health, MDs. And in order to really bring the best expertise to the places we work, we don't maintain a huge core staff of all of the disciplines we need. What we do is when we have a project where we have a specific need or needs, we can draw on that network of experts to come in and assist with those projects. And that helps keep our overhead low too, which is great. So I said I want to give you some examples of projects we've worked on, but I think we need to start with a little bit of history because we're based here in Idaho for a reason. TerraGraphics Engineering, our predecessor organization, started out at the Bunker Hill Superfund site in North Idaho. That's when TG was founded in 1984. And it was because of this site. This is the Bunker Hill Mining and Metallurgical Complex. You see the smelter there. It no longer exists, but you used to be able to see it from I-90. This smelter, in the early 70s, had a major fire. Just like a 30-second summary of what happened. That fire destroyed essentially some filters, some pollution control device on the factory itself. Rather than shutting down and fixing this, the company decided to keep operating because they didn't want to lose out on profits for weeks. And so what happened is they ended up operating without filtration, which, as you can imagine, releases an incredible amount of lead. This is a lead smelter into the environment. This poisoned communities all throughout the Silver Valley. Children had blood lead levels that were some of the highest in the world at that time. This is a graph of those blood lead levels. If you're not a math or science person, don't turn your brain off. There's just two things I want you to get from this graph. One is this bottom level here is what the CDC currently considers to be an acceptable level of lead in your blood, although we know that there's no safe level at any exposure, but that's where we kind of hit our target. It's at 5 micrograms per deciliter. Like I said, don't worry about that line. I just want to show you that this was the initial blood lead level at Bunker Hill, so you can see the difference between those two. And then over time, with the different responses implemented by local, state, and federal agencies, from environmental to public health, those levels came down below the level of concern and below even the national average. So this is what Bunker Hill looks like today. So if you're driving along I-90 in the summer when it's not covered in snow, this is what you see. It's a much different picture from what we saw in the 70s and 80s. And across the country, we were able to bring blood lead levels down by principally doing two broad things. One, it was holding industry accountable for their pollution. And the other is that government really did its job in the U.S. We passed legislation phasing out leaded gasoline. We improved our air quality standards. We removed lead in paint. And the U.S. Superfund program is really unique in the world where we, U.S. government, can sue companies and make them pay for cleaning up the sites that they contaminate. And that's not something you see in a lot of other countries in the world. And what this did is really improve the environment here in the United States. And I'm going to talk today a lot about lead poisoning and lead, but this applies to a variety of things. We can talk about mining in general. We can talk about recycling, pharmaceutical production, pesticide manufacturing, all of these things that in the US we used to do a lot more of, and we really restricted activities and made it a cleaner process. But with lead today, there are more batteries produced than ever before because the demand is higher than ever before. It's in our cars. We use it to store energy for alternative energy. And this results, the production of lead results in more pollution today than we've ever seen before in the US or outside of the US. And it also has resulted in more poisoning than ever before. And again, this is true of lead, but it's also true of a variety of environmental pollutants. This isn't limited to lead alone. It just kind of makes a good example, a convenient example. So I thought I'd talk about two sites where we have worked on lead contamination. One is in the Dominican Republic, and the other one is in Senegal. And these are lead battery recycling sites. Most of our lead today does not come from mines. It comes from recycling batteries. And so these sites are really common throughout the world. The other site I want to talk about is in Bangladesh. This is not a lead site, but it is a recycling site, and it's a really interesting study into the shift towards what we call informal industry or informal work. And then I'll talk about our project in Nigeria, which is our longest running project. We've been working there since 2010 with Doctors Without Borders, so I'll spend a little bit more time on that project. Just as a brief background on the Dominican Republic and then Senegal, this is a site where it was a factory that recycled lead batteries from cars, principally batteries shipped from the US to the DR. The factory shut down, and the retaining wall essentially failed around the factory. And so what happened is all this lead waste and sludge poured right into the adjacent community. It's poisoned dozens of kids. TerraGraphics worked with the local government and a local NGO and activists, and the site was remediated. So the picture you see in the left corner is a park and a newspaper clipping from Santo Domingo, and that's what the site looks like today. And this was all done by the DR government. The site in Senegal is a little bit different because this is not a company that was employing people. This is individuals who are recycling lead from batteries and selling it to traders, and it was then being shipped overseas, generally to India. And what happened was women were employed to recycle these batteries. They brought their children to work with them. They brought the lead home with them to keep it safe until they could sell it to the traders. 18 kids died at this site as a result of acute lead poisoning. It's really difficult to have a blood level high enough for someone to die. So this was considered the worst lead poisoning site of its time, to have 18 kids die. The cleanup involved removing contamination from the community, but it also had to involve cleanup in the homes. So you see in that bottom left corner, there's women using a wetback, and they're actually removing dust from concrete walls and floors in the homes so that kids are no longer exposed to lead. We visited Dhaka in 2014 with Doctors Without Borders. We worked with them on a couple projects now. They had started treatment centers in two slum communities of Dhaka. Principally, they were working on sexual reproductive health. But what they were seeing was they had a lot of patients who were presenting with what they thought were occupational related or environmental related diseases. And the reason they thought this is because when you walk around these communities, and Jeannie has been to this site with us, is between these homes and within these homes and everywhere spread out in this slum are these small scale, what they call factories. But they're really just kind of hack shop operations where they're recycling different types of products. So these kids are collecting plastic, not cleaning up the river. They're collecting plastic. What they're going to do is they're going to sell that to a recycler. And they're going to do that for a couple pennies. And this is an example of informal work where they're just selling it to anyone who will buy it. They're not employed by anyone in particular. And that recycler is going to sort that plastic. So you can see these women are working, they're handling all this plastic. It's going to get sorted. It's going to get made into these little beads. And that plastic can be melted down and used to create a variety of cheap goods. So we saw a lot of kids' toys being produced. We saw flip-flop sandals. I mean, anything you can think of as cheap plastic. This is how it might be made. And a lot of the trash comes into Bangladesh and goes out as cheap products. This isn't just true of plastic. There's a variety of different operations. There were textiles. In this photo we saw, you can see this young man is recycling aluminum. He's making some cheap pots. And it's probably hard to see with the light, but it looks like he has 5 o'clock shadow, but he's a little young for that. It's actually just dust from working in that environment. These are working conditions that we wouldn't see here, wouldn't be allowed here in the US today, but we are purchasing some of these products quite cheaply on the market. What MSF has, what Doctors Without Borders has been able to do is set up occupational health clinics in these areas. So what they've done is they both treat physical and chemical injuries for workers, but they also work with factory owners. And they've been able to pull in, again, from that network of experts I talked about, an occupational health expert who helped them determine different ways that certain factories could make improvements to working conditions and help reduce some of the exposures and some of the physical hazards that are going on in these places. Around the world, when we talk about places like this, children are more susceptible to these environmental contaminants for a variety of reasons. It's both physiological and behavioral. Mostly kids are still developing, right? So their brains are more sensitive to a lot of these contaminants. So a lot of these sites I'm going to talk about, we look at children being the ones we really want to intervene to protect. The good thing is when you intervene to protect children, you end up also having positive benefits for the whole community. So it improves the conditions for everybody. So in 2010, in northern Nigeria, a place called Zamfara State, Doctors Without Borders was doing routine surveillance for disease outbreaks like meningitis, cholera, measles. And they came across villages with exceptionally high mortality rates. And they couldn't really figure out why, because it wasn't malaria season, and the kids weren't responding to traditional drug treatment protocols. We later determined that over 400 children had died in the first 6 months of this outbreak, which was later determined to be lead poisoning. 10 villages have been impacted in 2 states, and tens of thousands of people have been poisoned. Again, children are most affected. They're the ones we see the high mortality rates in, but adults are also impacted by exposure to lead. This site is not a lead battery recycling site, so it's not like those 2 projects I just mentioned in Senegal or the Dominican Republic. This is artisanal gold mining. So in this region of Nigeria, they do, and have done for generations, what we call small-scale or artisanal gold mining. This isn't a company there that's responsible for a large-scale mining operation. It's individuals that are loosely organized who are out doing mining and selling the gold to traders. So how do you get a lead poisoning outbreak from artisanal gold mining? This is pretty rare. In fact, it's never been seen except in one other part of the world and not to this degree. We say it's the perfect storm because there were really 3 things that happened at one time that caused this outbreak. The first one is that the price of gold shot up in 2008 when the world economic crisis hit. So commodities like gold tend to increase in value when there's instability in our markets. So these communities that had been mining for generations now started participating in essentially a gold mining boom. And so they really ramped up their operations in comparison to what they'd done previously.